So you say no more dentures. So if a denture wearer goes to your practice, what are their options when it comes to dental implants?
Okay, so the first option that you have is overdentures. They're the most, and what an overdenture is basically a denture that you've got a couple implants that it'll snap onto. You could have 2 or 4. The problem is with an overdenture, it's still a denture. Now,
so it snaps in, snaps out.
Snaps out. The thing is with dentures, denture wearers know this, you're using the goopy glue all the time. So cleaning it out of the denture, you get rid of that. So it's a benefit. And you're not gonna lose it at this time you're yelling, cheering, it's gonna pop out the wrong. What you don't get with an overdenture, and why I'm just not real passionate about it, is food still gets stuck underneath there. They're still painful when you bite against that. It's still, we've got to deal with certain maintenance. A tooth pops off of it, or got to replace the little cylinders that hold it in. But there's things that with an overdenture, you still have the palate in there on the upper, right? So you're still, that's where a lot of the taste buds are. So as you're eating spices and foods and whatever, gagging, you feel that in the back of your throat, all of those things are still a compromise. So for what we really like to do is we like to get them in fixed teeth that don't come in and out. We want their teeth to stay in their mouth like natural teeth do, right?
And what's that process like as far as how many implants?
So it can be as little as 4 implants. That's what technology has changed. Used to, it was an implant per tooth and so expensive that it ruled most people out, quite frankly.
Okay.
Now we've done it where we can do 4 implants, do a full set of teeth, and it's a beautiful smile, and it's cut some of the cost to be able to do that, and there's no real downside to that. So when we talk about fixed teeth versus removable, when you're taking your teeth out at night emotionally dealing with that, that's not the same as something that stays in your mouth that you maintain like your natural teeth, right?
So how old can you be to do this?
So,
like, what's your oldest patient?
Yeah, so my oldest patient's 91. We
Really?
just 6 months ago.
Why would a 91-year-old want to do this?
If you're lucky enough to live to be 91 years old, what does your life look like at that point? I mean, it's being with family, eating foods,
good point. Okay.
Social, that sort of thing. And if you can't do that and you got to deal with dentures flopping around and moving, and honestly, if you're lucky enough to live that long, why don't you want to enjoy life to the fullest, right? When
so it doesn't matter how old you are, they're not more likely to fall out or whatever?
No, we have to plan every case, and not everybody's a candidate. I don't want to say that everyone. Most people are. I don't find many that aren't.
But this 91-year-old, how'd that work out?
Perfect. She's eating and chewing like she hasn't, and honestly, she hasn't. She probably dealt with them for 25, 30 years with dentures. Didn't know it was an option. And her daughter, here's some referred her daughter to me, and so she finds out. She's 91, thinking there's no way I can do this, and in a day, we changed her life.
So really, even in like 3 or 4 appointments, they could get a brand new set of teeth.
Right.
And these are permanent.
Right. Stay in your mouth.
But can you eat things like steak or nuts or chewy things, or you have to still be a little careful?
You can eat whatever you want to eat with them. Now, there are...
Just like your regular teeth. You want to stay away from ice cubes or whatever.
Right. You don't want to bite thread if you sew or whatever. I mean, you don't want to bite fishing line. I mean, things that could potentially break a tooth, you don't want to eat those things. Other than that, your diet's not limited. Eat what you want to eat.
And what do they like more, the smile, or do they like what they could eat?
It's a great question, and it's funny how that works, because it's the people that come in and say, yeah, I want the new smile. I want my smile to be right. And you go through this transformation and you give them the new teeth and all the things they go through. And those are the people that say, I didn't know all the things I was missing. I didn't know that I could chew and eat and taste things like I can now, and that it doesn't hurt, that I'm strong enough to do that, and my muscles work. I didn't have teeth to chew. So there's that side, and then there's the other side where the big burly guy comes in, I just want to eat and whatever. And those are the ones that are telling me, picking up girls now or whatever it is.
Okay,
it's changed their life.
The public, and I've learned this from you, and I've been interviewing doctors for 22 years, that they think all dentists have the same training, right? And I think we should mention that you are like less than 1% of all dentists even do dental implants.
Right.
Even less than that are board certified in implantology.
Yeah.
Is that right? Tell me a little bit about the training. And I guess it doesn't cost more to go to a guy that's been through all the training.
That's right. And actually, a lot of times it costs less, because you do this long enough, and with the technology, you learn how to do this in a cost-effective way. Where if I'm I can buy at a price point because I do so many of these that a guy doing one a year or one a month or whatever, those guys have to pay so much more, they're charging more. So most of the time I'd be anybody's price. So you're recognized as a
specialist in implant dentistry.
Right. The American Board of Oral Implantology is a specialty board, a governing board, that to be accredited through them, it's a rigorous testing where you have to go through, you have to do implant dentistry for 7 years before you can even apply.
Okay.
You have to submit 75 cases. You've got to give 10 specific cases where you really have to identify everything about the case. You take an entire day of written boards. The next day you come in for oral boards. So you're just getting grilled on all these questions. They're evaluating your cases and then other cases you have to defend. So at the end of all of that, that's a different person, a different level than someone who hasn't gone through all that. And quite frankly, to get to that point, to go through that, it's probably cost me $300,000, $400,000 of my own money to get to that point for education.
Okay.
Where if you don't go through those things, how can you be at the same level? How can you market yourself as being so great?
But this is the challenge, with medical doctors and everything. It's like, so what does the patient do?
Right.
Ask, are you board certified?
Right.
But they're timid, right? People like.
Right. So if you're looking for, that's right. So I say do your homework, do your research in any decision in life, particularly decisions that are this big. So when you're doing your due diligence, look at their before and after. See what they're doing. See if they're their own photos or if they're somebody else's. Look at the testimonials. For us, we have video testimonials where we just video the patient telling their story because we don't, unfiltered, transparent, this is the results that you get. Look at their credentials. See, are they someone that places an implant a month, 2 or 3, or is this someone that's doing...
you do more, this is fair to say, you do more in a month than most guys do in a year or 2.
I would say that's very accurate. It's just a matter of the volume of patients that we do based on implant dentistry.
And this is all you do.
This is all we do.
Your center is you don't do like fillings and crowns and veneers.
No.
All you do
we
is
have
implants.
partner dentists that we can help you find, help you get to those people. But for us, everything, whether it's surgery or whether it's the prosthetics associated, the teeth associated.
Now, what
implants.
takes other guys like 10 months, you do in just a few visits.
Right. So
could you give me a simple answer to that? Like, what are you doing that makes you so fast?
Yeah. Well, it's part of it's the technology because I can capture all that information in one appointment. I don't have to have you come back several times to do that. Part of it is we don't have to go to an imaging center to take the image and then go to another dentist to go see what's the plan and then go to the surgeon. All of those appointments are combined. We can, with the technology, we combine all those record appointments to one appointment where we can plan, this is how it's going to be. So we minimize the number of appointments that you have to come in. So at the end of the day, 3 or 4 appointments, we can do all this. Now the question is, there's a little bit I can do to change how bone metabolizes, how fast bone can grow to implants and how solid they can be. There's a certain amount of biology, we're gonna have to wait. There's some people that fly in from out of town and come from all over where they need their teeth. They don't want to come back and forth and they need the permanent final teeth, not having to wait 3 or 4 months. For those people, within a week, start to finish, they have their permanent teeth.
So somebody watching this with no teeth, next week, they could have new teeth.
That's right.
That don't come in and out.
That's right.